Delegates, colleagues, dear friends, it is a pleasure to join you today and to follow the important opening reflections from the Minister for Infrastructure and the Chief Medical Officer. Now, across Europe, we are increasingly observing that people living in more disadvantaged urban areas often have less access to quality green space than those in more affluent neighborhoods. This is important because regular access to green space is consistently associated with lower levels of stress, improved mental health, increased physical activity, and a reduced risk of non-communicable diseases. Green spaces can support both physical and mental health, strengthen social connections, and contribute to climate resilience. In many ways, places such as parks or tree-lined streets can shape health outcomes in a very tangible way. But alongside this evidence, there is also a human dimension. A child having a safe place to play, an older adult able to walk comfortably and stay connected, or a family stepping outside and feeling a sense of belonging in their community. There's now a strong and growing body of evidence showing that access to quality green space is not simply beneficial, it is fundamental to health and well-being. At the same time, this is where an important challenge remains. Too often, those communities who would benefit most from safe, accessible, and well-designed green spaces are the ones who have the least access. So when we speak about green space, we also speak about fairness, inclusion, and the kind of future we're shaping for our communities. The opportunity ahead of us is to respond in a way that is coordinated, sustained, and equitable. And the question before us now is, how do we carry this understanding forward? How do we translate strong evidence into sustained, system-wide action? From the experienced cities across the WHO European Healthy Cities Network, we're seeing that progress becomes possible when a number of key conditions come into place. The first is strong alignment across sectors. Green space sits at the intersection of many areas such as health, planning, housing, education, and infrastructure. And what is encouraging is that more and more cities are beginning to work across these areas in a more integrated way, recognizing that health is shaped well beyond the health sector alone. Looking ahead, continuing to strengthen this whole of government approach will be essential to delivering lasting impacts. Now, the second is clear and sustained political commitment supported by shared accountabilities. We are seeing that where there is leadership that brings partners together around a common vision and where responsibility is shared across sectors, cities are better able to move from goals to implementation. The third is a shift from pilots to systems. Many cities are already testing innovative approaches, and the next step is to build on these experiences to scale, adapt, and thirdly, to embed them into policy, planning process, and investment decisions. This is where we begin to see change, not only in individual projects, but also across entire systems. In this context, the WHO Healthy Cities Phase 8 framework offers a helpful way of bringing these elements together. Through the 7P approach, it highlights how priorities such as people and place are deeply connected, linking health outcomes with the environments in which people they live their daily lives, whilst also recognizing wider benefits for communities, climate, and local economies. What this perspective offers is a way to move forward with a shared understanding to create healthier, more inclusive, and more sustainable cities. Encouragingly, across the Healthy Cities Network, we are already seeing this in practice. Cities are embedding health considerations into planning, strengthening partnerships, and taking steps to ensure that investments in green space reach those who we need the most. As you move into the discussions ahead, there is a real opportunity to build this momentum, to continue exploring how green space can be positioned as essential spaces for health, how partnership can be strengthened across sectors, and how implementation can remain focused on equity and long-term impact. Because ultimately, this is about the kind of cities we are choosing to create, where everyone, regardless of where they live, have the opportunity to live a healthy life and where the spaces around us actively support that vision. So not only for today, but for generations to come. Thank you.